Hey, I'm Dr. Josh. I'm sorry I missed you at the dinner a couple nights ago, but I wanted to give you a quick recap of what we covered at that dinner talk. And so I always start my dinner talks talking about the trail of type 2 diabetes. There's always a day one. There's always a diagnosis day. It doesn't matter if you're 15 to 20 years into type 2 diabetes, or if you've just got rubber stamped on your forehead, or you're 2, 3, maybe 5 years into this where things aren't that bad yet. There's always a day one. It's the day that the doctor's office calls because the doctor wants to review your most recent blood labs with you. And typically when you get that call, there's a lot of angst with that. I've been on that side, and when you get that call, you're like, what the heck is going on? Why does the doctor want to meet with me? Because what's wrong with my blood? At any rate, there's always a day one. And when you walk into the doctor's office that day, it typically goes like this. Mr. Patient, it's good to see you. I have your blood labs. Unfortunately, I don't have very good news for you. Your blood sugars are high, your A1C is high, I'm diagnosing you as a type 2 diabetic, and I have your first oral diabetic medication ready for you. And typically, what's that first diabetic medication of choice? It's metformin. So you're going to start yourself on metformin. Oh, and by the way, you better start losing weight, you better start dieting, and you better start exercising. And typically that's how a diabetic is diagnosed on day one, and typically that's how a diabetic is counseled on day one. Okay? So when you're done with that visit, here's what you've won. You've won a 6-month date with the doctor, you've won your first oral diabetic medication, and you've won the recommendations to diet, exercise, and lose weight. At this point in time, it doesn't seem so bad. You know, things aren't bad. You don't feel anything. You're diagnosed as a type 2 diabetic, and you got to go on with your life. But as the trail of type 2 diabetes continues to go on, this is your 6-month routine. Doctor's office, blood labs. Blood labs aren't into the prescribing doctor's best recommendations, so you're going to get another oral diabetic medication. At this point, it's typically glipizide. You're also going to get your statin and your blood pressure medication. So now you've got a few more drugs in your satchel, okay? And as time continues to go on and those blood labs are not in alignment with the prescribing habits of the doctor, you're going to get a pill for every ill. And that's how the standard of care continues to go, one visit after another. Blood pressure, weight, blood labs, things don't look so good, get another medication, okay? And so that's just how a diabetic is treated over time. All along the line is that diabetics typically don't get better over time. Diabetics typically get worse. Now, if I back out of that for a second and talk about blood sugars. Blood sugars being high, everybody knows, every doctor knows that blood sugars are high are very dangerous. And the job is to try and bully those blood sugars down. But where there's smoke, there's fire, okay? And what we do in the standard of care is we continue to try and fan the smoke, but the fire is still smoldering. What I mean is that all type 2 diabetics have a causative or multiple causative reasons to why they can't regulate their own blood sugar. But as we go on and we continue to try and manage blood sugars and bring them down, most of the time not being very successful or being effective, the causative factors, the reasons to why somebody can't regulate their blood sugar are still ongoing and ongoing and ongoing. So after you get your oral diabetic medications, after your A1C continues to climb, after you can't get your blood sugars down, after you've tried every diet on the planet, after you've exercised yourself into oblivion, okay, what happens here is the last-ditch effort to control diabetes is putting a diabetic, on injectable insulin. And at that point, the trajectory of life continues to dwindle. It continues to fall. And the reason I know this story is because I lost my father last August to type 2 diabetes. I know the story well. I've seen it. I've seen the progressions and the regressions, and I've seen the deterioration of health. And it's not fun, and it's not fun for everybody. And that's why I help offer a way off of this trail. And that's what I explained in the dinner. So then the dinner moves into, well, why isn't my doctor doing this for me? It's because your doctor simply doesn't know the process of being able to reverse type 2 diabetes. Their job is to prescribe you medications and to keep your blood sugars from going out of control. And then what happens, and what we discuss, is this turns into the blame game. And the blame game houses itself on a number of different myths and misinformation. Number one, your genetics, okay? And so if type 2 diabetes is related to a gene, because I'm the son of a type 2 diabetic and a grandson of a type 2 diabetic, then I guess I'm screwed. Okay, and now 1 in every 3 people in the United States is diagnosed with either prediabetes or diabetes, which means that all these humans are genetically susceptible to type 2 diabetes? I think not. Is it in families? Yes. Do families practice the same lifestyles? Yes. Do families live in the same environments? Yes. We cannot confuse genetics with family relations and how we all do the same things in a familial standpoint. Okay, so genetics is it's a myth, it's a misinformation. The second one is because your weight. Because you're overweight, you're going to get type 2 diabetes. That couldn't be further from the truth. I treat diabetics that are 100 pounds, 125 pounds. I treat diabetics that are 300 pounds, and I treat diabetics that are everywhere and in between. So weight is not a factor. Weight is a symptom of a deeper cause. Okay, the next one, it's because of what you eat. Now, every diabetic restricts and limits their carbs. Every diabetic starts to restrict the food that they eat. I'm going to go on a diet, paleo, Mediterranean, keto, with very little, if no success. The less food that you eat, the worse you're going to get. Diabetes is an energy-depriving disease. Think of this. The first thing primitively that we do as humans is we breathe oxygen to live. The second thing that we do is we consume food to combust into usable energy. At the root cause of type 2 diabetes, we cannot produce energy for our cells to live. If we can't produce energy for our cells to live, we expire. And that's just the name of the game, but we're not addressing that. We're just trying to fan the smoke of the fire with trying to keep the blood sugars down. So you can win that battle, or you can keep that battle under control, but you're never going to win the war. Okay? So diet has no part in this. In fact, we diet ourselves into being worse. And no diabetic of mine in my program, I never tell a diabetic that they're eating too much. So genes, weight, diet, it's because you don't exercise. Because you don't exercise, you're going to get type 2 diabetes. Well, exercise acts in 2 forms. Number 1, exercise is good for a eustress. When you exercise, you expend energy to break yourself down and build yourself back up. But when you're breaking yourself down as a type 2 diabetic and you don't have the energy to build yourself back up, you continue to tear yourself down. So if you're having a 500 calorie diet and you're over exercising yourself, you're going to expire faster than normal. And so this is the misinformation. You got to eat the right foods. Every diabetic needs a different type of food plan because every diabetic has a different reason for being a diabetic. And exercise is put back into the regimen when your body can handle tear down and build up. And the last thing is it's because your pancreas produces insulin, so your pancreas is no longer working to produce the insulin. That is baloney on the type 2 diabetic part. There's 2 different types of diabetes, type 1 diabetes, type 2 diabetes. Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the pancreas, so you can no longer produce your own insulin. It's called insulin dependence. Type 2 diabetes is insulin resistance. So there is a receptor, an insulin receptor on every cell in our body. And it connects with the insulin to drive the sugar into the cell to make usable energy. In a type 2 diabetic, this mechanism has gone wrong. Whether it's something wrong in the cell, in which the body is not letting the sugar into the cell, or it's because something is blocking the receptor. And if something's blocking the receptor, then the insulin cannot connect to the receptor, or the receptor is worn out. So when we shove more insulin into a body that's insulin resistant, it doesn't make any sense because you still can't utilize that insulin. Not to mention that insulin is a fat-storing hormone. And because it's a fat-storing hormone and an anabolic hormone, the more insulin that you put in your body, the bigger that you're going to get, the more problems that you're going to have. So we discussed that at the dinner. And then lastly at the dinner, I talk about how my functional medicine successfully gets people out of type 2 diabetes. It reverses their type 2 diabetes. And so we define what reversing type 2 diabetes means. Number 1, reversing type 2 diabetes means getting off of all medications. And I'm not talking just oral diabetic medications, but I'm talking about medications across the board. Now, it is irresponsible and foolish just to stop your medications. And the paradox in this system is that you get well while you're on the medications to give yourself the objectives in order to show that your doctor that you can start to reduce, if not eliminate, your meds. Number 2, increasing energy across the board. When you get your body to function right, you're going to start producing your own energy. And when you produce your own energy, you're going to arrest the process and you're going to heal. Number 3, lose weight naturally. My patients are losing anywhere between 10 and 15 pounds to 50, 60, 70, and 80 pounds naturally. That means without exercise and without special diets. No one around here is ever going to tell you that you're eating too much. Okay? Arresting and reversing diabetic complications. Now, everybody has access to Google and they know how to Google diabetic complications. And so I don't need to explain those. But what this system does is as you get well, you can reverse the neuropathies, the eye damage, the kidney damage, the cardiovascular stress. And so this goes away because you're getting well. Okay? And lastly is to objectively demonstrate on labs, on the black and white paper, that you are reversing type 2 diabetes, that your A1C is coming down, that your glucose levels are coming down. By the way, how many of you absolutely know what your A1C means? So we're being diagnosed as a type 2 diabetic with blood sugar levels that are elevated and a high A1C. And that's it. And everybody goes through the same protocol with their medications and going down that diabetic trail. And so this is individualized and customized functional medicine. It's a very proprietary system that I use. And I figure out why diabetics are diabetics. And I treat you, the patient, the person, as a person, and we figure out exactly what your system needs to be in order for you to reverse type 2 diabetes. So this is everything that we go over in the dinner. Like I said, I'm sorry that you missed it. But what you have now is access to all the testimonials, and I shouldn't say all, a few of the testimonials that I've been able to put on a page. You can click right here, and you can go through some of the testimonials of some patients that have had a lot of success in my program. I can't put them all in there, just a few in a snapshot. Also, you can download this ebook that's there, and the ebook is going to give you a little bit more of an indication on the things that I cover in the dinner. So I hope that serves you well, and if you have any questions, just reply to this email. I'll be happy to answer any questions that you have, okay? So go ahead and do that, and I wish you the best in health. So keep trucking away, keep plugging at it, and if I can help you out, let me know. Talk to you soon.